Hey y'all, we're back. We're going to do the female reproductive tract today. Um, it's great for me because I'm back in my element. This is where I live. I'm happy to be in female reproduction. And for you, it's good because you'll have gotten a lot of the terms and concepts already yesterday with the male reproductive tract. And we now use those same terms and concepts um, and apply them to the female reproductive tract. So let's do that. So we're going to start similarly, where we looked in the testes and we found a sperm and how do we mate a sperm and move through the tract. We're going to do the same type of tour. So this picture shows a nice picture of the internal structures, so the structures on the inside of the body. And most of the female reproductive tract is inside as opposed to outside with the male. You'll see that oval structure that's white and looks like an egg. Sounds kind of familiar, right? That is the ovary. In the ovary lie all the eggs that the female will ever produce, even from birth. So they're all there, as opposed to the male who makes sperm over and over and over. The female is born with all the eggs that she will ever have. At birth, there's about 1 million eggs, and then by puberty, there's about 300 to 500,000 eggs ready to go. Follicle stimulating hormone, which we heard that term yesterday, recruits about 10 to 20 follicles each cycle. And what is a follicle? Follicle just means a sac-like structure with something in it. We think mostly like a hair follicle. But here it's an egg follicle. And FSH starts recruiting a bunch of follicles every cycle, but you don't have a lot of eggs coming out. You have only one. So how does that happen? The FSH also starts the production of estrogen, and in conjunction with another hormone that we heard yesterday, luteinizing hormone, the estrogen and luteinizing hormone come together, and they pick one follicle that's going to be dominant and prominent and will come to ovulation, releasing an egg. Okay. An egg in the human is also called an ovum, O-V-U-M, ovum. And it's the size of the head of a pin. And this is released from the ovary, one egg once a month. Okay. Now, when the egg comes out of the ovary, it actually spurts out into the abdominal cavity, but we don't want that ovum wandering around the abdominal cavity. We want it to stay in the reproductive tract. So the fallopian tube, you'll see that tube-like structure with fingers that are around the ovary in this picture. In reality, they're not totally around that ovary. They're a little bit off to the side, and they start to sweep and pull that ovum egg into the tube and starts to bring the egg through the fallopian tube. Now, just to bring it back to a lecture that I heard you have in months past, there's smooth muscle in the fallopian tube, and you might remember peristalsis of the GI tract, where it in waves brought that smooth muscle brought the contacts of the GI tract through. Well, it's the same thing with the fallopian tube, same concept. The smooth muscle acts to move that ovum through the fallopian tube going towards the uterus. Okay. Now, a lot of people think that the egg is sitting in the uterus waiting for some sperm to come in and to cause a pregnancy. That's not how it happens. All the fertilization takes place actually in the tube. And for best fertilization, if you're trying to get pregnant, the ideal is to have active sperm, healthy, young, just came out, sitting there waiting for the egg to be released, and they glom on and pregnancy happens. Now, I remember a picture from when I was a medical student. I wish I could find this picture for you, but I cannot. With the egg present, sperm are just like, they're all flying in that direction towards the egg. When the egg was absent, they were just kind of wandering around, hanging out in the reproductive tract, nothing going on. But as soon as an egg was around, boom, they were all hightailing it right to the egg. So there's some sort of mechanism where the egg can call the sperm, come this way. So it's all fun and interesting. Now, this is a picture of a sperm fertilizing an egg. So coming towards the egg, the sperm then surround the egg. You see the outermost portion of the egg is it's called the zona pellucida. You don't need to know that term, but it's like a protective barrier, a protective coating. So you can't have one sperm fertilize an egg. You have to have a bunch of sperm, because in the head of the sperm is an enzyme that helps break down that protective coating. And finally, one sperm can get through and fertilize the egg. And that's how pregnancy happens. Once the ovum is fertilized, it's called a zygote. You don't need to know that term either. But that zygote continues through the fallopian tube, goes into the uterus for implantation. Okay. Now, if there's no pregnancy that happens, then the ovum goes through the uterus for expulsion. Okay. So let's talk a little bit more about the uterus. The uterus is a muscular organ. It looks like an upside down pear. The lining of the uterus, which is the central part where the ovum would implant. The fertilized ovum would implant if there was a pregnancy, is called the endometrium. And I want you to know the term endometrium, because it's a term that's common enough that you may hear it in medical circumstances, and it's an important term. So endometrium. This tissue creates a place for the fertilized egg to implant and grow. If there's no implantation at the end of the cycle, it sheds, and the endometrium becomes the menses or menstrual period. Okay, same term, menses, menstrual period. Now, the bottom portion of the uterus is called the cervix. And you've probably heard of the cervix before, because when people say I'm 5 centimeters dilated, they're talking about their cervix when they're going to have a baby. So under non-pregnancy circumstances, it's basically a point of connection between the uterus and the vagina. It has an opening that allows sperm in and menstrual blood out. It also helps hold the pregnancy inside until it's time for delivery. It also releases mucus, which is a barrier to pathogens. So you can imagine there's an opening between the inside of the uterus and the vagina. And if there were to become bacteria that could flow into the uterus, that would not be good. So the cervix blocks that by having mucus there, protecting the inside of the uterus and the inside of the body from pathogens. But during the time of ovulation, you want the sperm to be able to get in. You don't want a nice thick barrier there. So during ovulation, that mucus gets thinner and allows for the passage of sperm. It's like super cool, right? Let's talk about the vagina, okay? The vagina is a hollow, stretchy, tubular structure that's the connection of the uterus to the outside world, okay? Don't confuse this with the vulva. Very often when people see their doctor, so I'll often hear, oh, I have a problem with my vagina, and it turns out to be the outside. It gets very confusing. So if you actually know that the vagina is the inside tube and the vulva is outside, it's really helpful for communication. You get a better communication with your doctor and better diagnosis if you can use these terms. So I think it's helpful if you can start to get the terms right. So vagina is inside. It's that hollow, stretchy, tubular structure. The length is about 3 to 4 centimeters long, and the width and the length expand with sexual arousal. It also can expand so much that a baby can pass through it during delivery. So you can imagine a 7-pound baby can pass through what normally is a tiny little tube, but it stretches and then it returns back to size. The vaginal walls secrete a protective fluid into the canal, and it's one of the sources of sexual lubrication. It's innervated, it's sensitive to sexual touch. And in the vagina, there is healthy bacteria and fungi that make up a normal vaginal microbiome. It's essentially a self-cleaning system where the prominent bacteria, lactobacilli, so you don't need to know that term, but a lot of people do know lactobacilli. It's also in yogurt, but not quite the same thing. The lactobacilli secrete antimicrobial and anti-inflammatory compounds, helping clean out the vagina. This is why you don't need any douches or any kind of cleaners inside the vagina, and it's actually more healthy and your bacteria are happier, your normal microbiome are happier if you don't put anything in. So this picture I wanted to show because it shows the pelvic anatomy from a side view. Now, the front is the round structure. There's a little white round structure. That's your pubic bone. The back, you can see a buttock here. Look how closely the bladder, which is that open balloon type structure with the urethra coming down, the uterus with the vagina coming out, and the rectum, look how close they are all together when you in real anatomy. So if you're having some sort of issue or pain in the pelvis, can you imagine how hard it is to figure out what you're feeling? Because they're all really closely tied together. So that's why when you're trying to figure things out, like you go to one doctor, it may actually be the other doctor. You may need to see a urologist when you are having pain. It turns out it's in your bladder and not your uterus, or it turns out it's in your rectum and not your ovary, and that's pretty normal. Those structures have sensation that is not the same as if you banged your arm. This sensation is more of like a sensation that if you banged your arm here, you would feel it all over here. It's just the way it is. It's a different kind of innervation. So it makes it harder to figure out what's going on, but you can see why. Okay. So let's go to the outside. Now this is where the vulva is. And I tried to think of a good way to help you remember vagina is inside and vulva is outside, and I couldn't come up with anything. So if you come up with something, let me know. So the top, so if we're looking from at this picture, the top to the bottom. So from the top is the pubic mound. It's a hairy area over the pubic bone. There's a fatty tissue underneath that helps protect the pubic bone and the more sensitive structures during intercourse. Then you look at the other hairy area along the side, and that is called the labia majora. Those are the major lips. Okay. When we go more towards the midline or medial, those are the labia minora, the minor lips. These lips are hairless, and what they do is they serve to protect these sensitive structures that are underneath, okay? At the top, they come together covering the clitoris in a clitoral hood, also for protection. When we spread the labia minora and look at from top to bottom in this picture, we see that on the top is the clitoris. It's what you see on the outside is called the glans clitoris. It's the most outer portion of the clitoris, but it's also very highly innervated. It's very sensitive to the touch, and it's the main source of female sexual arousal. Internally, however, the structure is made up of erectile tissue. You'll hear these terms from yesterday, the corpus spongiosum and the corpus cavernosum, same structures that were in the male penis are in the clitoris itself. And there's a crus, a root on each side. Sounds very similar, right? Then between the clitoris and the vagina lies the urethra, okay? And you remember from previous lectures, that's where the urine comes out, okay? Now, this is just for nursing students and in pre-meds. So if you're nursing or pre-med and you're going to be putting in a Foley catheter at some point to drain somebody's bladder, when you are looking at the female urethra, there are 3 tiny little openings. On each side of the urethra, there's little gland openings from the Skene's gland, and those provide lubrication. But it makes it really confusing when you're trying to put in a catheter and you're just starting out. Actually, I will tell you, it confuses even people who have been doing it for years and maybe don't know the anatomy the same way. So you want to hit the middle, which is the urethra, not the outer divots, which are the openings to the Skene glands, okay? Clinical students only, nothing you need to know. The next opening below the urethra is a larger opening. That's the vagina, okay? That's where we've been coming from the inside now to the outside. The area under the vagina, you don't necessarily need to know this either, but you might hear the term. It's called the perineum, and it's a thick area of very muscular, and it's in between the vagina and the most posterior opening, which is the anus. Okay. And that completes our tour of the female pelvic anatomy. Our next video should be pretty fun because it's going to put all of it together in the menstrual cycle, and we'll talk about how does the menstrual cycle affect different parts of the body, and it should be pretty fun.